The staff on Ward 24 were wonderful. The person who had arranged for Dad to go there was his geriatrician, Jeff Okpala. As another doctor said to me, Jeff is a national treasure. This was very good care, it was great care, because firstly, it was, as they say, focused on the patient. Focused not on just, Mr. X in room Y, but on Ian. Good morning, Ian. One of the first things I would say to everybody who came in, who met Dad for the first time, they'd say, good morning, Mr. Paterson. And Dad always had this joke, don't call me Mr. Paterson, that's my father, he's been dead for years, I like to be called Ian. And so they treated Dad as Ian, and they showed great attention to his dignity and to his comfort and to his health needs. So all those elements of care that was really attentive to the patient's needs. Coordination, that was important, left hand knowing what the right hand was doing. The attitude of providing care. There's been a lot of talk about the need for more compassion in our health system. I figure that people who choose to work on a rehab ward with many elderly stroke patients, I suspect that they are drawn into that sort of work because they care. But it was so evident that people cared. The morning that Dad left, I saw I saw people in tears. I mean, they cared. They cared for my father, and that was so evident in the way they responded to him and to us as a family. And so, that comes from the heart. You can't write rules for that sort of thing. And I felt that the leaders of that ward set a tone of we're here to care for our patients and for their families in the best way that we can, and they really did that. The healthcare assistants, wonderful, very experienced woman, probably about my age, called Kathy, and she was great. And I watched the way that she would, on one occasion, she said to a nurse, when I was just saying, oh, just be very careful, because I was concerned about Dad's skin catching when he was being moved, and I was very concerned when they would sponge him. Dad had a lot of small skin cancers, and it would be very easy to knock the heads off them and he would bleed. And so I would say, no, just sponge like this. And on this occasion, Kathy said, listen to the son, he knows his father. And I was struck by a very mature, experienced health practitioner with the confidence to speak up and say, listen to the son, and just guiding the other members of the care team. I would certainly encourage nurses in particular, and OTs and physios, to be saying to the family, now you might want to help Dad, this is what we've shown him to do at the moment, we're doing this arm raising exercise. The more that you can involve the family, you'll give them the confidence to sort of step into the breach. So there's that, and then obviously there's the asking questions about the plan and so forth, and that's a trickier one, because I'm sure it's the case that having a family with a doctor and some background in medicine, we would have just felt a bit more comfortable asking questions. So somehow you've got to create that space for any family to be able to, ask questions. Now you'll be wondering what's happening next, or you're going to have questions that come up from time to time. Here's the person to ask about that. I think that would be really helpful. Even for us, there were people who we were never quite sure, so is that person the pharmacist, or how do they fit in? As an outsider, it is a complicated world. The rules said that you could bring in a small dog on a Saturday, so we brought Monty in on a Saturday. The first Saturday was actually Mum and Dad's 59th wedding anniversary, and Monty, who's very lively, jumped up on the bed, and so that was great, and it was great for Mum as well, because Mum, one of the things that Mum was worrying about was that she was always having to leave Monty in the car, and she was checking up on how Monty is, and as time went on, we had the confidence to say, look, can we just bring Monty in? And they were fine about that. And of course, the other patients loved seeing Monty, and the staff loved seeing Monty. There were one or two occasions when he sort of disappeared, we had to run after him, but he was very well controlled. And that way of making people at home, especially for an older couple like my mum and dad, you know, Monty is absolutely an adored member of the family, and so it meant a great deal to Dad. He would really perk up when Monty would get up on the bed, and Monty would lick Dad's hand, and you could just sense in Dad, even right near the end, that this was lifting him. So that was a special thing.